Video 9, Identifying Stakeholders and Partnerships Area CHES Subcompetencies 1.1.5. Review the learning objectives for this video. Now we are getting into something that can truly make or break your needs assessment, and that is stakeholder identification. This is one of the earliest and most critical steps in any health education needs assessment. A stakeholder is any individual, group, or organization that has an interest in or will be affected by the health program you are planning. Getting this right ensures that your assessment captures the full range of perspectives needed for effective programming. Let me walk you through the key types. Internal stakeholders are those within your own organization. These include program staff who will implement the intervention, administrators who allocate resources and approve plans, and board members who provide governance and strategic direction. Their buy-in is essential because without organizational support, even the best assessment findings will not translate into action. External stakeholders exist outside your organization but have a direct connection to the health issue or the community. These include community members who experience the health problem, partner agencies that provide related services, funding organizations that support health programs, local businesses, faith-based organizations, and elected officials. Each brings a unique perspective and set of resources. Now here's a term I really want you to know well for the CHES exam: gatekeepers. A gatekeeper is a trusted individual within a community who controls access to that community. This might be a religious leader, a tribal elder, a neighborhood association president, or a school principal. Gatekeepers can open doors that would otherwise remain closed, and without their support, you may be unable to reach your priority population. Key informants are individuals who possess specialized knowledge about the community due to their role or experience. A local physician, a social worker, a longtime community organizer, or a public health nurse can provide insights that no dataset can match. And finally, and this is so important, representatives of the priority population itself must be at the table from the beginning. The principle of nothing about us without us is a foundational value in health education. Including priority population members as stakeholders ensures that the assessment reflects their actual experiences, needs, and priorities. You are building the relationships that will make your work meaningful. Let me now walk you through two formal partnership structures that appear regularly on the CHES exam: coalitions and advisory boards. While both involve bringing multiple stakeholders together, they serve different purposes and function in different ways. Understanding the distinction will help you on the exam and in practice. A coalition is a group of organizations and individuals that join forces to address a common health issue. Each member retains their own organizational identity but agrees to work collaboratively toward a shared goal. Coalitions are powerful because they combine the resources, expertise, reach, and credibility of multiple organizations. For example, a county tobacco-free coalition might include the local health department, a hospital system, the school district, the American Lung Association chapter, faith-based organizations, and a youth advocacy group. Each organization brings something different to the table, and together they can accomplish more than any single organization could alone. Coalitions are particularly useful during the assessment phase because they provide access to diverse data sources, multiple community perspectives, and established relationships with hard-to-reach populations. An advisory board, by contrast, provides guidance and recommendations to a specific program, project, or organization. Advisory board members offer their expertise and perspectives, but typically do not have direct decision-making authority. The program director or agency leadership retains final authority over decisions. Advisory boards are valuable because they bring outside perspectives into organizational planning. A community health center advisory board, for example, might include patients, local business owners, social service providers, and public health professionals. Their input helps ensure that programs are responsive to community needs. For the exam, here is the key distinction to remember. Coalitions are collaborative partnerships among multiple organizations working toward a shared goal. Advisory boards provide expert guidance to a single organization or program. Both are essential tools for community engagement in the assessment process, and knowing the difference will serve you well. Building effective community partnerships is not something that happens overnight, and I want to be honest with you about that. It requires a deliberate and systematic process, but the effort is absolutely worth it. Let me walk you through the 5 essential steps. Step 1 is identification. Before you can engage stakeholders, you need to know who they are. Conduct a stakeholder mapping exercise where you list every individual, group, and organization that has a connection to the health issue or the community. Cast a wide net. Include obvious partners like the health department and hospital, but also consider less obvious stakeholders like transportation agencies, employers, housing authorities, and cultural organizations. Step 2 is assessment. Not all stakeholders have the same level of influence, interest, or resources. A stakeholder analysis helps you prioritize your engagement efforts. Map each stakeholder on a grid with 2 dimensions, their level of influence over the health issue and their level of interest in participating. High influence, high interest stakeholders should be your closest partners. High influence, low interest stakeholders need to be kept informed and engaged. Low influence, high interest stakeholders are often your strongest community advocates. Step 3 is engaging gatekeepers early. This is so important. Gatekeepers can make or break your access to the priority population. Approaching a community without the support of its trusted leaders can lead to distrust, resistance, and failed data collection. Take the time to meet with gatekeepers individually, explain your purpose, listen to their concerns, and ask for their guidance. Step 4 is establishing structure. Effective partnerships require clear roles, expectations, and communication channels. Who is responsible for what? How often will the group meet? How will decisions be made? Putting these agreements in writing, even informally, prevents misunderstandings and keeps the partnership productive. Step 5 is maintenance. Partnerships require ongoing nurturing. Share findings regularly, celebrate accomplishments, give credit publicly, and involve partners in decision making. When stakeholders feel genuinely valued, they remain engaged and committed. The exam tests your understanding that community engagement is not a one-time event, but an ongoing process that requires intentional relationship building. And honestly, this is where the most rewarding work happens. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. The correct answer is B because low participation in culturally diverse communities often reflects a lack of trust rather than a lack of incentives or time. Gatekeepers, such as community leaders, religious leaders, or cultural organization staff, can bridge the gap between the health educator and the community by lending their credibility and facilitating introductions. Option A may help but does not address the underlying trust barrier. Option C could introduce digital divide barriers. Option D does not address why people are not participating. Summarize the key takeaways before